All right, so my name is Richard,
I'm Sean.
And I'm Hazel.
and today our presentation is going to cover asthma.
So, in general, 1/4 of adults in the United States do not engage in any type of regular exercise, and almost half of those who do exercise fail to meet the federal physical activity guidelines for aerobic and muscle strengthening exercises. So, individuals with asthma, in particular, may be at risk for failing to meet these federal guidelines for physical activity because exercise is often a trigger of those asthma symptoms that we will be talking about. So, for the definition for asthma, it is a disease that causes a chronic inflammation of the airway wall.
So, looking at the pathophysiology of asthma, it is an airway limitation. So, how that happens is through an airway hyperresponsiveness, which is the ability of the airway wall to be sensitive to various inhalants, which causes bronchoconstriction. And bronchoconstriction of the airways in the lungs happens because of tightening of the surrounding smooth muscle with consequent coughing, wheezing, and shortness of breath. And then also the CD4 lymphocyte is believed to promote inflammation as well, causing edema formation, which is um, basically excess fluid and causing thickening of the airway wall. Some host factors that cause asthma is gender, genetics, and obesity. And environmental factors are airborne allergens, viral respiratory infections, mold, tobacco smoke. And diagnosing asthma, we look at lung function using the spirometry, which measures airflow in the lungs and determines if there is any airflow limitations. And basically what you do is, like in the pictures, you'd blow into the machine and it would measure your forced expiratory volume and your forced vital capacity. And if the spirometry measures that you have a decrease of 80% of your predicted forced expiratory volume, then you do have airway limitation. Or if your forced expiratory volume or forced vital capacity ratio is less than 65%, you have airflow limitation.
All right, so going into more detail, what Sean reiterated was we're going to go over the risk factors associated with asthma. There are many factors that can trigger asthma symptoms or attacks, which is either coughing, shortness of breath, chest pain. Some environmental factors include indoor air pollution, which could be mold, noxious fumes, and some examples of those are household cleaners and paints, any fragrances, and dust. For another environmental factor is cold temperature. Um, there's some studies that say that cold temperature uh, causes bronchoconstriction, which is just tightening of the air walls. And also for temperatures is high humidity, which can lead to coughing and shortness of breath. Uh, as for other factors, there's air pollution, which can be pet dander or pollen, which just irritates the lungs. Uh, cigarette smoke as well. There's also a link between asthma and obesity. Uh, with less exercise and obviously lack of motivation just because you have asthma, it can lead to weight gain if your diet is not adequate. And as for disease frequency, um, according to some studies and statistics, uh, there is a link between asthma and gender. During early childhood, boys are more likely to have asthma comparing to girls. However, some experts say that it's because young males' airway size is smaller compared to girls at that point in time. As for age, around 20 males and females who are diagnosed with asthma are fairly similar. so there's no big discrepancy between each gender. Uh, However, when around 40 years old, women are diagnosed with asthma, um, are more likely to be diagnosed with asthma comparing to males. As for exercise-induced asthma, which is triggered with vigorous exercise, 80 to 90% of people who are diagnosed with asthma experience exercise-induced asthma. And for national statistics of the United States, for the population, around 8% or 25 million uh, have asthma.
So some symptoms that are recorded with that follow along with asthma is sometimes we need to keep in mind that symptoms are not felt even with 20% decrease in forced expiratory volume. So sometimes people may experience having asthma symptoms, but it's not, they have to be clinically prescribed to any medications following it. So often with these symptoms, they experience wheezing, breathlessness, chest tightness, coughing occurring during the early morning or night, only because they may not be able to regulate how much they breathe in while they're sleeping. And some key history symptoms is what they would be doing, like if they used to smoke or they were around smoke a lot or any high pollutant cities. Uh, that could be a recordance of how they gained asthma over time. And also, death can occur with individuals with mild asthma over time as well.
So for treatment for asthma, there are inhaled medications that are widely used, and they some are used long term, which usually are taken daily for persistent control of asthma, and that basically reduces the underlying inflammation in the lungs. And an example medications for that is corticosteroids. And sometimes you need a quick relief for acute symptoms, which uh, which is a which an example of medication is a beta agonist. Another treatment is regular exercises. It's recommended for individuals with asthma to improve their exercise capacity, improve quality of life, and reduce intensity and frequency of their asthma symptoms. So when exercising, there are some exercise limitations. Like Richard went over, cold air, low humidity, air pollutants can exacerbate the asthma. But if those are under control, some cardiorespiratory fitness we can do is 20 to 30 minutes of aerobic exercises 2 to 3 days a week at least, 50 to 85% of heart rate reserve. And for individuals with more severe asthma, an RPE scale is recommended for intensity. And examples of types of exercises we can do for aerobic training is the treadmill, stationary bike, walking, or swimming.
And as for resistance training, um, for resistance training to avoid exercise-induced asthma, warming up is very crucial, as you don't really want to spike your heart rate. With a spiked heart rate, it increases breathing, and when you increase breathing, you have a more likely chance to um, get or obtain exercise-induced asthma. So a prolonged warm-up, which is around 15 to 20 minutes, should be suffice. Uh, with asthma patients, uh, you would want to prevent labored breathing. So make sure the client isn't holding their breath. Usually, with clients, they like to hold their breath either or, like the eccentric or concentric of the exercise. So we just want to prevent that. Inhale during the exertion phase, and just slowing down the movement and focusing on form. Make sure you're breathing right, and yeah, those are some recommendations. However, there is no resistance strain regimen specifically for asthma clients. However, we with the accommodations we could always test one out or with the accommodations, you could always do an resistance training exercise. And um, just to reiterate, we could just do resistance training for mainly for general health. Uh, we found out that 2 days minimum should be suffice on non-consecutive days with 48 hours of rest in between muscle groups, 40 to 60% one rep max, 2 to 3 sets, 15 to 25 reps, 10 to 15 workouts within the workout regimen, and 2 to 3 minutes of rest in between sets. Uh, but because we're handling clients with asthma, you always want to assess the route to see if you want to make any more modifications for the exercise regimen.
So aerobic exercise effects on asthma is shown to improve lung function, decrease airway inflammation, um, helps with to reduce asthma attacks, and decrease anxiety and depression, uh, which is also important because a lot of the times, uh, as individuals with asthma are scared to engage in exercise because of the idea of having an asthma attack during. So types of aerobic exercise that that the article that we read showed that varied aerobic exercises would help with asthma, including biking, running, circuit training, swimming, and even strength training. But the downside to the study was that no studies determined the effects in the long term.
And here are just some asthma prevention for people who have asthma. Asthma doesn't have a cure, but it can be prevented and regulated. What you want to do for a person that has asthma, or if you do have asthma as well, is to identify the triggers and avoid uh, those exercise conditions at all costs. And it doesn't have to be for exercise; it just be in general. Like you just want to avoid maybe air pollutants, cold air, humidity, uh, places where with a lot of dust or pollen, et cetera, et cetera. During exercise, always carry an asthma inhaler that contains albuterol because this helps dilate the lungs to help with breathing. And get a flu shot, as people with asthma have more complications once getting the flu.
So, in conclusion, with our article, asthma patients prefer low intensity exercises over high intensity exercises due to the misbelief of appropriate intensity. So, many patients do not want to take the risk of having a high intensity workout only because they would go in shock or they would feel as if it would permanently damage the way they would see physical activity. However, various types of aerobic exercises has shown a greater chance of psychological and physiological improvements on asthma because aerobic exercises can be readily available, such as walking and running at their own favorite speed or type of speed. And many or psychological factors, such as anxiety, often trigger the success or failure of regular physical activity in asthma patients, which can explain the absence of any form of exercise training involved. So, with those that are working with asthma patients, they have to accept or keep in mind that some of them are very sensitive to what they are told to do. And with that, they should keep in mind that physical activity should be a gradual increase with their symptoms and with the environment that they're in. Okay? And that's the end. Thank you.
Two.
Richard says bye.